Hi, I'm Claradina Soto. I'm an associate professor in the Department of Population and Public Health Science in the Keck School of Medicine. I would like to acknowledge that I am Navajo from my mother's side and Jemez Pueblo from my father's side. As a behavioral health scientist, I had the opportunity to testify to the United States Senate Committee on Indian Affairs regarding the fentanyl crisis in Native American communities. This was really important because of the high impact of opioid overdose impacting our Native communities, especially when compared to other racial ethnic communities. We have high overdose rates, some of the highest overdose rates, high fentanyl use and high overdose from fentanyl use as well. So this was a really important time to be a part of this conversation, to be able to address the research we're doing here in KSOM with our tribal and urban Indian populations here in the state of California, to have the Senate understand the needs to reach this community and to address the opioid use epidemic. So I've been able to work with many tribal and urban Indian populations, primarily here in the state of California. And knowing the opioid epidemic that's hitting Indian country, we've been able to do some really great work with the community, by the community, for the community. And one of our first was a needs assessment, a statewide needs assessment to listen to the community, from elders, from the youth, from those that have lost loved ones to opioid overdose. And we reached about 300 individuals throughout the state of California. That perspective was so essential for us to understand what was happening in the community, the needs of the community. We talked to Indian health clinics because they too didn't have the proper services and the needs to help support the community. So this really provided recommendations not only to funders to help support our communities here in the state of California, but also then to get funds to our tribal and urban Indian populations to be able to really support their recovery services and services in general. For example, we had learned that culture is really essential to the healing of an individual, especially when in recovery. And so culture is a part of integrating that into the services to help somebody that is ready to work on their sobriety. We learned that, the youth need mentorship, they need programs for prevention. So prevention is also a really key component. We learned about this to be able to help save the lives of our young ones. And so mentorship programs are needed to help establish and for them to be educated on the harmful effects of the opioids that are impacting and hitting our communities. We learned from elders that they too can be the ones to share their wisdom on how to help somebody on the road of recovery and to be a part of that healing and that medicine that's needed for the community as well. We heard from clinics that needed services, medication-assisted treatment services, also known as medication for opioid use disorders. These programs were essential and needed in their clinics to be able to provide these services, which is medication, right? It's to provide buprenorphine, naltrexone, along with behavioral therapy for individuals to help in their recovery. But again, this really taught us about the cultural healing aspect that was needed. So this needs assessment was really essential to get the voices out, to help the funders understand what was needed for the community. Much of our work to address the opioid crisis in Indian country really stems from community-based participatory approaches. And one of them is working with the tribally community-defined best practices. And these are funded entities throughout the state of California, primarily American Indian organizations and our Indian health clinics, to provide recovery services, MAT, integrating culture into their recovery services for those that are trying to get the support to address their opioid use disorders or substance use disorders. We are really essential in helping with providing support, TA, but additionally evaluation. And evaluation is key for many of these funded grantees because we oftentimes don't get that data to understand the impact that they are making in the community. So we are able to provide that support to create data collection tools to really evaluate the impact that they're having in each of their communities, how their program is reaching individuals, how it's making an individual impact, a community impact, even evaluating their organization. So this is really critical to not only have this data to support and show to their own tribal leadership, but also to our funders as we want to continue sustaining these programs to reach our Native communities and address the substance use and opioid use disorders. Our research-funded projects that we currently have that I'd like to mention is one, is efforts to increase the collaboration with local entities, counties, state governments, with tribal and urban Indian communities. This is something that's really important to be able to establish those partnerships, building the trust within each of those entities to really provide and improve the well-being of our Native communities. And it is important to have the voice of our community. So being able to have that collaboration, increase that collaboration, is something we are working towards. As a Native researcher, addressing the opioid epidemic and the research work that we have here is so important because, again, this is really impacting the lives of our Native communities. And this work has been so essential to reach individuals, to better support and understand and have the voice of why recovery, why culture, why services, why the needs are so needed in this community by the work that we're doing with our needs assessments, by talking to the community, by working with those, getting the funding to evaluate and to understand the impact that they are having. Being able to support the policy work with our advocacy training. Policy is so needed, and I feel like that's something that needs to be fulfilled in our community as we do have advocates, but to build up that advocacy to meet the needs of our community. And to be able to just, again, really be the voice of this community. So that means being able to work directly with them, to listen to their stories. It's very heartfelt, it's very saddening, but it's also very encouraging because this community is very resilient, and culture is medicine, culture is healing, and that is something that I have learned in working directly with these communities. And I hope that we can maintain that partnership as we build upon what we're learning now in working with them to sustain these efforts and to also sustain and support the lives that we need to save to address this opioid epidemic. One of the great things that's happening with all of the great work that's happening in Indian country to address this, again, many of these communities have funding. Not to say that it's completely funding everything, but there's a lot of great work coming out of this and a lot of great culturally relevant resources, and I mean even prints, health promotion prints, to be able to educate our community on, what is the opioid epidemic. The California Consortium for Urban Indian Health, one of our community partners working with urban Indian populations here in the state of California, is going to be hosting a website with all of the materials developed by our Native communities for Native communities on addressing the opioid use disorder, substance use disorder. So these would be educational messages, pamphlets, brochures, posters, to be able to have educational pieces for the community. Trainings, videos will be made available on this website. That should be coming soon by summer of 2024.